Ready? All right, good afternoon, everyone. Like she said, my name is Stevie John, and I am the long-term care ombudsman with the High Country Area Agency on Aging. We'll get into what an ombudsman is here shortly. The High Country Area Agency on Aging covers a 7-county region in the High Country. We currently have 11 nursing homes in our region, 11 assisted living facilities, also called adult care homes, and we have 4 family care homes. And so we'll break that down here shortly to figure out what each of those care levels mean. So our agenda is looking into choosing a long-term care facility. So what types are out there? How do you choose one? How do you get admitted to a facility? What's that process? Once you get into a facility, what does that look like? And also resident rights, because that's the cornerstone of the ombudsman program. And so we'll dive into that a little bit deeper as well. But I believe that knowing your rights as a resident in a long-term care facility will greatly enhance your experience there in a long-term care facility. So I think it's really important to know your rights, and it's just as important as knowing some of these other topics. Please feel free to jump in anytime with questions. I'm happy to have conversations. I'm a better listener than a speaker, so I like having conversations. Please, jump in with anything that you have. So what in the world is an ombudsman? An ombudsman is an advocate for long-term care residents. You may have heard that term in other fields, such as the Army, probably here at the university. There may be an ombudsman, but essentially we are advocates for residents. So the resident is our client. Anyone can call me and make a complaint, but we look to the resident to guide our actions to help them with their concerns. In general, we protect the rights of residents. So anything that falls under resident rights, which we'll get into a little bit later, is what we help residents with. We mediate concerns on behalf of residents. So we're not regulatory. We cannot give the facility deficiencies or penalties. We're more mediators. We're kind of like a middleman. We negotiate with the facility to try to get that situation resolved. And it's usually in their best interest to work with us so that it doesn't have to go up the ladder to a higher authority. We also train staff and community on resident rights and other aging topics. So we do aging sensitivity training, elder abuse prevention is a big part of our work. And we also provide technical assistance to the public and facilities. So a lot of times facilities will call ombudsman and ask, what should we do in this situation as it pertains to resident rights? Are we doing the right thing? And then also the public calls us a lot just to navigate long-term care, like we're going to talk about today. So what is the role of long-term care? Long-term care is a necessity for many. So it's estimated that 70% of Americans will need long-term care at some point in their lifetime. And that can mean different things, which we'll break that down a little bit later. But 70% of us may need long-term care at some point. It's a place to provide care for those needing help. So long-term care facilities just have more amenities, services, and trained staff to help with certain situations that we may find ourselves in. It's a place to receive rehabilitation. So you might not be there long-term. It might just be to go maybe after you've had a fall or a knee replacement, you may need to get some short-term rehabilitation. It's also a place for respite. So caregivers can take their loved ones to a long-term care facility for maybe a weekend stay, a week stay, so that they can get a break and a chance to refresh themselves while their loved one is in a long-term care facility short-term. So long-term care is not an inherently bad place. I know during COVID, we've heard a lot of horror stories on the news. We always hear, nursing home did this, but they're not all bad. So we're going to talk about how to do your research to, make sure that you're in a place that meets your needs. It's not an indication that you fail as a caregiver. You get these calls a lot. People are just, depressed. They're sad that they had to put their loved one in a long-term care facility, but that's what they're there for. They can offer the services that you can't at home. So sometimes it's just a necessity. And of course, it's nothing to wish. So we're going to get into the levels of care. We're going to break these down. If you notice up here, I didn't put independent living because I don't have any jurisdiction over independent living facilities. They're typically more apartment-like. They're not regulated in the same way that these other facilities that we're going to talk about are. So I'll break these down. In North Carolina, we have family care homes. Those are homes with 6 or fewer residents. These are typically in someone's home. And they're regulated by the state of North Carolina, the same way that assisted living, or what we call in North Carolina adult care homes, they're regulated in the same way. But they're really typically in someone's home. So it's more home-like. They don't offer kind of that higher need of services. So people who may need a little bit more help might not be the best fit for them. But it's a very home-like setting with 6 or fewer residents. Assisted living, they offer different services to help you with your activities of daily living. That could be things like bathing, dressing, medication management, 3 meals a day. They do not have a nurse present. They may have a nurse present, but they're not required to have a nurse. So some people may be surprised when they go into assisted living facility to find out there's no nurse present. Typically, this is a place just to help with medication management and general activities of daily living. A skilled nursing facility, also known as a nursing home, is for your higher acuity needs. So maybe a person needs wound care, IVs, just a situation that they need a registered nurse available. So that's going to be your higher acuity residents. You may also need rehabilitation. So that's typically located within a nursing home. And this is your short-term stays. So this, like I said, you may have left the hospital because you had a knee replacement, someone may have had a stroke, and so you need to go to get skilled rehab. This could be physical therapy, occupational therapy, or speech therapy. There's another type of facility called a continuum care retirement community, or a CCRC. We do not have any of these in our region as of now. These usually require a pretty substantial buy-in. You have to have pretty good resources to be able to get into one of these places. And people usually go in as independent and then they move up the ladder. So they have independent, then they go to assisted, and then skilled if necessary. And then special care units could be in a nursing home or assisted living facility. These are locked units for people that have a diagnosis of dementia. And a lot of times it's for folks that may wander. So that door is locked and those staff have training on dementia care. And just because a facility has a locked door does not mean that it's a special care unit. A lot of facilities we see now are locked just to protect the residents. Yes.
I've been surprised, I guess, at the increase in memory care units and assisted living. And I'm wondering, like, what differentiates a special care unit and assisted living from one that's in a long-term care? Is there a difference?
So the difference is the need. So you're saying like a nursing home locked unit versus assisted living. And you're right, there are a lot more locked units for dementia care in assisted living than nursing homes. And the only difference is that person that needs the nursing home level of care has some kind of what they call a skilled need. So they have a need for a nurse to be present. They have higher medical needs than someone in assisted living who has a diagnosis of dementia. But other than, their brain health, they're kind of healthy people, they're walking around and doing pretty well.
Man,
Yes.
you started off with a statement about 11 places in our area. I assume the 11 is an assortment of that group up there, number one, and define our area.
Sure, that's a good question. So our 7-county area that the Area Agency on Aging serves is Allegheny, Ashe, Watauga, Wilkes, Avery, Mitchell, and Yancey. And we have 11 nursing homes, 11 assisted living facilities, and 4 family care homes. And I'm happy to provide that list.
So a total of 26. Is
Yes,
that what you're saying?
that's what we have in the 7-county region. So it's actually pretty low. I mean, if you're looking at more metropolitan areas,
Okay.
especially with the family care homes, we don't have very many. If you look even in more rural areas across the state, there are a lot more family care homes than there are up here in the mountains. And I'm not sure why that is, but you're welcome. Okay, so how do you determine your level of care? How do you determine, do they need assisted living? Do they need skilled nursing? So it's going to be based on their physical ability. what assistance is needed and how much, what they call ADLs, your activities of daily living. What your health needs are. Do you need a higher level of care? Do you need wound care? Do you need to be on certain medications? Do you need trach care? Do you have morbid obesity where you may need a bariatric bed or more bariatric equipment to take care of you? So all of that comes into play. Also your cognitive ability and wandering risk. And the doctor will determine your level of care needed, and we can talk about that in just a second. So payment sources, this is a big question that I get all the time. How do you pay for it? So of course, if you're private pay, if you have the means, I think any facility will take your cash. If you're needing assisted living or adult care home, the only option for assistance is what they call special assistance. Having quote Medicaid, it's not, they use it interchangeably with Medicaid. It is not Medicaid. It's a county state program that provides assistance to low income people to cover that gap in cost of care. I don't know the exact dollar amount right now, but I believe it's around $1,200 for assisted living and around $1,500 for if you need a locked unit. That's your total assets per month. So I guess your Social Security or your disability. So it's very low. If you did want to apply for that, you call your county social services and see if you're eligible for that. If you are going to a skilled nursing facility, a lot of people go in under Medicare. So that's going to cover your short-term rehabilitation needs. If you need to stay long-term, most people end up going on long-term care Medicaid, which you can apply through your county Department of Social Services. Nursing home care is about $80,000 to $100,000 a year. So a lot of people do end up eventually going on Medicaid if they need to be in long-term. And then other sources of payments, veterans benefits, if that's available to you, private pay, and then some people have long-term care insurance. So choosing a facility, just like when you bought your home, you did research, you visited different homes, you looked at your assets to see what you could afford. Same going into a nursing home or assisted living. So you can go onto the Department of Health Service Regulation website. All of these resources will be available to you at the end of the presentation. And you can look up what's called their statement of deficiencies. So you can see what the state has cited them in the past for any deficiencies they may have. I would say, certainly look at those, but it's only a blip in time from when that survey team was in there that day. So it's not going to give you everything you need. It's not going to tell you everything about the facility. So when you're trying to decide on which facility to pick, visit the community, schedule a tour. Then also try to go maybe when the management staff is not there. Management's usually there 8 to 5 Monday through Friday. So see what it's like on the weekend. What is it like at night? During your visit, use your senses. What does it smell like? Is it loud? Is it quiet? Talk with the residents and family. Ask them what their experiences are. How do they like their time there? What are their concerns, if any? How could they improve the facility? Observe staff and resident interaction. So are staff being kind to residents? Are they being helpful? Or do they look busy and they're not interacting with the residents at all? Observe noise levels, cleanliness, odors, activity level. Like, are residents out and about having fun? Or are they all in their rooms with their doors closed? Look at a room with a resident's permission. Ask if you could go in to chat with them. Does it look home-like? Does it look comfortable? Does it look like a place your loved one would enjoy living at, or you would enjoy living at? And think about preferences. So if you go into a facility and everyone's doors are closed, but you like to be a social person, that might not be a good fit for you, or vice versa. If everyone's out being really boisterous and having fun and eating together, and you're more of an introvert and you like reading quietly in your room, might not be a good fit for you. So thinking about your habits and how you would fit in that facility. So the process of admission is not quick. Most of the time when I get calls about this topic, it's usually at a moment of panic, because it's not something we normally think about. What are we gonna do when we need long-term care? Or mom or dad needs long-term care until it's happening. So, it's a good idea to go ahead and start thinking about it and to plan where you would want to go, or, have things lined up. Because typically when it's time to go in a long-term care facility, you have a lot of other things going on at that moment. So to be prepared and ready is always a good thing. So admission, finding your way, there's different ways that you may enter a long-term care facility, from home to facility. You may go from hospital to facility or transfer from facility to facility for different reasons. Could not like the facility you're in, or you're in assisted living and you need more care, so you go to nursing home, or vice versa. You get well and you need to go to assisted living. So if you're going from the community, the first thing you need to do is go to your physician and ask him for a form called an FL2 form. That's the most important form, FL2. That gives you an overview of your health, your medications, your diagnoses, and he's also going to check a little box, he or she, that says you need nursing home care, you need assisted living care. So that facility is going to need that paper first and foremost. If you need financial assistance, call your county Department of Social Services and tell them, looking to move into assisted living, I'm looking to move into a nursing home. Those programs are different, so specify which one you need, and they can help you look at your assets to see if you're eligible for financial assistance. Find a facility that's a good fit for you and also a good financial fit. So it might not be a great idea to move into a facility if you only have enough funds to pay for a year. Just looking at your options. The facility will conduct an assessment on you or your loved one, and that's just to make sure that they're going to be a good fit for the facility, but it's also a good time for you to ask questions to make sure the facility is going to be a good fit for you. You'll do a TB skin test. A lot of times there's a COVID vaccine verification, and of course a bed must be available to provide to you. Any questions so far? Okay, so if you're admitted from the hospital social worker or discharge planner will help you find a facility. It's a good idea to look for some facilities on your own though, because the hospital is likely going to choose the first available bed, and it might not be what you want. So it's a good idea to have some ideas of where you want to go or possibly want to go, because you don't want to be in Boone and then end up in Sparta, say. You want to be around your friends and family. So it's a good idea to give them some suggestions as well. If you're going from a hospital to a nursing home or to a skilled facility like rehab, you have to have a 3-night stay in the hospital. I think this was changed during the COVID emergency. I believe it's changed back now. If you do have questions about that, contact Medicare. You have to have a need for physical therapy, occupational therapy, or speech therapy, and you have to be admitted to the facility within 30 days of hospitalization. And if you go from hospital to assisted living, they will also help you look for facilities. They'll send out referrals to those facilities for you. But it's a good idea, like I said, to have some in mind that you would be interested in. Okay, so you're admitted to the facility. Now what? Visit frequently. If you have a loved one in a long-term care facility, visit. Just see what life is like for them there. Know that the residents have rights. It's not all about what the facility wants. Residents do have rights, and we'll dive a little bit deeper into those rights shortly. Share your family members' preferences or your preferences and routine, your likes or your dislikes. So if you took a shower every night before you went to bed, you probably don't want the facility poking you at 6 a.m. saying, come on, let's get a shower. You need to let them know what your life was like before moving in so they can adjust to your preferences, because it is your choice. You do have choice. If your loved one or you have any triggers, traumas that might be set off in the facility by something, it's important for the care staff to know. Be involved in the care plan. So care plans are done quarterly. And I can't stress it enough, if you can go to these, please do. Because this is where a team of management get together and discuss your care. So it's only as good as if you attend. If you're not there, they're gonna care for you how they want to care for you, and you're not gonna have any input in it. So it's a great time for you to be there, to ask questions, to ask about medication changes, to talk about therapy that you may need. It's a great time just to put your concerns out there. So always attend your care plan if you can. If you ever want the ombudsman to be there, if you're having a lot of concerns, give me a call. Medicare benefits, know before you go. A lot of people just kind of go into long-term care thinking their Medicare is going to pay for 100 days, and a lot of times it doesn't. Most times it doesn't. And so people are surprised when that's cut off pretty quickly. And you do have an opportunity to appeal if your Medicare coverage is ended. But just know what your coverage is before going in if you can. Make observations, ask questions, don't make assumptions, and support the resident's right to remain in control of his or her life. So, you know, it's okay to be a squeaky wheel. It's, you know, if you don't say something, it's not going to change. So it's important to let people know how you want to be treated. So talking about key contacts in the facility, it's a little different in nursing homes and assisted living facilities. In the nursing home, there's an administrator. They're the person that's over the facility. There's the director of nursing. They have a social worker and a therapy manager. So depending on what your concern may be, would depend on who you would need to talk to. But when in doubt, talk to the administrator. You know, it's okay to talk to your care team that's on the floor, the CNAs. But a lot of times if you have a larger concern, you may want to take it up the line to get that resolved. In assisted living, it's usually an executive director, a resident care coordinator, an activity director, and a supervisor in charge. So just a few items to note. When you go into a facility, you do not have to allow the facility to be your payee, to act as your payee. You still have a right to manage your own finances. So a lot of times they will ask, you know, to hand over your social security check. And that's absolutely fine if you're comfortable doing that. But if you don't want to do that, you don't have to. You have a right to manage your own finances. You have a right to know about anything you want to know about your care, your medications, your services that are provided. You can ask for a copy of your trust account anytime. You can ask for a copy of your medications. The only thing I would say that you might not have access to is if an incident happened, because that would be an internal document, but you can have access to your medication, your medical chart at any time. Yeah.
What is an incident?
So an incident report is if something were to happen in the facility, say 2 residents got in a fight, as an example, and you come in and you say, I want to see that incident report. A lot of times they'll say no because it is an internal document. But that's when you can call the ombudsman, you can call the state and have them look into it. Pay attention to the contract you're signing. It's a really, really stressful time. And so you're just signing your initials on every page. Read the contract. If you're feeling stressed out, have someone else look it over, because there could be things in there that you don't want to agree to. So it's a good thing to look that over carefully, especially pre-arbitration agreements. If you want to know more about that, I can send you some resources, but essentially you're signing your right away to sue the facility. So just read that carefully before you sign those pre-arbitration agreements. And you have a right to a discharge notice in writing and a right to appeal it. So if you get into a facility and they're trying to boot you out, you have a right to appeal. So how do you solve problems once you're in a facility? Each facility has their own resolution and grievance process. So ask for that information in your admission packet. That should be there. Talk to the person who has an impact on your concern, but with it, like if you have a doubt, just contact the administrator and ask them about it. Be as specific as possible. So if you have general concerns, it may be hard to resolve. You know, the food is awful. What does that mean? Is your food cold? Are you getting served pasta every day and you don't like pasta? You know, what is the concern? Be specific. Prioritize your concern. So if you have a long list of concerns, my suggestion is to request a meeting. But you know, the most important to the least important, and you can always call the ombudsman program if you need assistance. So we're gonna get a little bit more into resident rights. You have a right to your possessions. So you have a right to bring your own clothing into the facility, of course. One of the common complaints that we get in the ombudsman program is that clothing is lost. So always label your clothing, inventory your clothing, take pictures of it if you can. Just to make sure that you have a record of that. Of course, you can hang up pictures, make it home light, bring in any adaptive equipment you may need. And you have a right to manage your funds like we discussed, and right to have lockable space in your room. You have a right to information, so a right to have your questions answered in a timely manner. You have a right to see your lab results, your diagnoses, your x-rays. You have a right to see what charges are being incurred. You have a right to see what your medications are, and you have a right to not take medications if you don't want to. You have a right to see the rules and the policies and the resident rights. You have a right to vote. You have a right to go out to community engagement. And you have a right to file a concern or grievance without the fear of retaliation. Privacy. So you have a right to use your phone in private. That could be a facility phone or your personal phone. They have to have a phone available for you to use in private. Your mail, you should receive mail unopened unless you give consent to the facility to open that mail. You have a right to privacy during visits. So you have a right to have visitors of your choice in the facility at any time, as long as they're not causing any issues. You have a right to privacy during receiving care. So, I don't want to see someone getting pushed down the hall and, with a towel on. That's not dignified. You have a right to have a curtain pulled when you're receiving care. You have a right for the staff not to talk loudly about your medical conditions in the hall. And you have a right to know if you're being recorded or video surveilled. And of course, you have a right to be free from abuse, neglect, and exploitation. You have a right to be free from that from staff or other residents. That includes verbal abuse, physical abuse, and sexual abuse, theft and exploitation. It should be reported immediately. Everyone in here is a mandated reporter to report abuse. And also physical and chemical restraints cannot be used, which is an interesting topic because sometimes I'll have families call and say, they won't put a seatbelt on mom in the wheelchair and they can't. So sometimes your concerns are, they can't be honored because of regulations. So that would be considered a physical restraint. So anytime someone cannot physically remove the seatbelt or get themselves out of the bed from the bed rails, that would be considered a physical restraint. And chemical restraints are using certain drugs to kind of numb someone down to the point where it's a convenience for staff. So you always have a right to ask about those medications those people are on, ask for a reduction in those or removal of those drugs if you think they're being used for a chemical restraint. So talking about discharge rights, this is probably the #1 complaint we get in the ombudsman program across the state is involuntary discharges. So there's only a few reasons that you can be discharged from a facility. Is if your health is improved and you no longer need the level of care. So maybe you're in a nursing home, you've gotten better, you don't need that level of care anymore, so you go to assisted living, something like that. You need more care than they can provide, they can't meet your needs, so maybe you're in assisted living and you need a little bit higher level of care. That would be a legitimate reason to discharge someone. If you're a threat to the health and safety of others, and then if you're not paying, you have to pay your bill. You do have a right to appeal those, and so the ombudsman contact is on the back of, or on page 2 of the discharge notice. So it must be given in writing using a proper form, must include an appeal page, must be issued 30 days prior to the discharge unless there's an issue of a safety issue, must be given in hand to the resident and the responsible party. This is not the same thing as a letter from Medicare saying that your payments have ended or your benefits have ended. This is separate, saying that the facility can't meet your needs for whatever reason and they're asking you to leave. The discharge must be planned and safe. So if they are threatening to try to kick you out, it must be planned and it must be safe. So I get calls all the time. The facility, the daughter is frantic because the facility wants the family to come pick up the resident. They just can't handle them anymore. That's not a safe discharge. So, my advice is don't pick them up unless you think you can handle, that person in your home, which you probably can't because they wouldn't be in a long-term care facility. When in doubt, call the ombudsman. We're pretty knowledgeable about discharge cases and appeals. So it must be a safe discharge. You should be involved in decision making and informed. So you should have a say in where you go. And your new destination should be appropriate to your level of care. So if you need nursing home level of care, they can't discharge you to an assisted living facility because that wouldn't be safe. Okay, before your discharge. So this is if you decide you do want to go home. Make sure you have all the equipment you need. Do you have a bed? Do you have a lift, wheelchair, walker, whatever you may need? Can you get in and out of the home safely? Do you need a ramp built? Are there new health care tasks that someone needs to be educated on, such as wound care? And how do I get my medications once I leave? If you are being discharged, but you don't feel you're ready to be discharged, ask for a 30-day discharge notice. So back into problem solving, know the chain of command and attempt to follow it. Like I said, you can talk to the CNA on the floor. They know a lot about your loved one, but it may not be the best person to talk to get a problem resolved. So going up to higher management could be helpful. Of course, staying calm, communicate facts and not feelings. My suggestion is if you're having a lot of concerns, write them down. Write down the time that it happened, write down specifics, who was there, what time it was. That's going to help them to resolve the issue. Ask for a care plan meeting. Like I said, the ombudsman can be involved in that as well. Share concerns, but listen to. Facilities must follow protocols and regulations. So sometimes, they're doing something for a reason because of a certain regulation. If you're referred to a policy, ask to see the policy. I hear that a lot. Well, it's in our policy. Let me see the policy, please. Be reasonable. There's a lot of people out there. There's a lot of people to care for, and learn and follow the grievance procedure. So what is their procedure there? And make sure that they're writing up those grievances. Communicating. I didn't make this slide, but I don't know if you've ever been into a long-term care facility and you were visiting a resident and they had a bunch of signs posted all around their bed that says, don't do this to mom, don't do this, do this, don't do this, don't do this. It's not a great way to communicate. It's also not very dignified for that person to have their information plastered all over the wall. So, if the staff aren't doing a lot of things that you think they should be doing, ask for that care plan meeting. And if they're still not doing it, call the ombudsman. I can see why these, a note or two could be helpful, but sometimes it's not as dignified to have that information all over the room. So taking it further, if you have an issue and you just don't feel like it's being resolved, you can call the long-term care ombudsman. There's an ombudsman in every 100 counties in North Carolina. If it's a resident rights violation, you can call us anytime. If we can't handle it, if it's not in our jurisdiction, we can direct you to the person that can. Take it to resident council. So resident council is a group of residents that typically meet monthly to discuss concerns in the facility. It's a good place to have a collective voice to share concerns. The adult home specialist. So the adult home specialist is the regulatory person in the county for assisted living facilities. So that could be a good person for you to call if you have regulatory concerns. Adult protective services, of course, if there's an abuse situation. You may also want to call 911 if there's an immediate danger to someone. The North Carolina Complaint Intake Unit, that's with the Department of Health Service Regulation. That is the state entity that comes in. And so if you file a complaint with them, what will happen is you'll get a letter. They'll say, sorry for your concern. A team will go out and investigate your complaints. And then you'll get a letter back saying whether that was substantiated or not substantiated. And then law enforcement, of course, if needed. That went through that fast. And I have a lot of different resources here. So you can look at the the list of facilities in our area. I have links to all of this. Information about special assistance, Medicaid and Medicare, how to find the nursing home surveys and the star ratings. Information about the ombudsman program, social services, and then the complaint intake.
I can't write that fast. Do you have a handout on that?
I think they will mail it out.
That's what I'd ask.
Yeah, they will mail it out, I believe. Do you do email?
Yeah.
Okay.
Okay.
And if you have any other questions that come up, feel free to call me anytime. I do have a list of resident rights handouts over here, so feel free to take one of those as well.
A lot of times during your talk, you refer to people outside that are. wanting to do service. What if you don't have it?
What if you don't have anyone to help you navigate through the confusion of long-term care? What was the last part of that?
Someone who is not in the facility to keep an eye on what's going on.
Unfortunately, I don't know if there is like a case manager. Is that kind of what you're thinking of? Someone who can help you like navigate through the system?
Well, I'm just thinking of these various situations that you would have described in the state. Your person should exist on that.
Yeah. They can always call the ombudsman program, and we're happy to try to help them navigate through this stuff. Social services can also be a good resource in their county. Your local senior center can also be a good avenue to check in with. I guess it just depends on what the need is, but if it pertains to searching for long-term care, they can certainly call me or the ombudsman in their county, and we can kind of help navigate through that.
Back when you were talking about assisted living, you said nurses are not required. So the level of care is delivered by CNAs. Who has oversight of medications being given to patients?
They're called med techs, medication technicians, and so they're trained medication technicians. They're almost like a step above a CNA. They're not nurses.
What's the level of their training and understanding about medications and side effects? And
I don't know the number of training hours off the top of my head, but I mean, it's certainly not what a nurse is, and it's typically they're looking at a computer and they're popping it out of a prepackaged, folder. So I don't think it's a great deal of training. But
even to observe in the patient reactions, untoward reaction. So assisted living is.
I guess, it is for, I guess, a person who doesn't need as much care, but yeah, I mean, I get those complaints all the time. They gave me the wrong medication, or I didn't get my medications. So if you do have the ability, when you're getting your medications, ask them to tell you what they're giving you. Make them say it out loud as they're giving it to you. So that you can double check, because medication errors is an issue.
So in the 7-county area that she said, how many ombudsmen are there in that county?
Just one, just me.
Oh my God.
Some of the more metropolitan areas have more, of course, because they have more facilities. So the national standard for ombudsman is one ombudsman for 2,000 residents. So we're about that in our region right now. We have asked the legislature for more positions across the state. We're about 11 positions shy, I believe, 11 or 14 across the state. So one ombudsman for 2,000 beds is the national standard.
How would we contact you?
I have business cards up here. I have some bookmarks with my number on it. So contact me by email or or phone. Yes.
Ask a little bit about long-term care insurance, and I know that's too detailed, but I'm just aware of some situations where people have plans that they've invested in for a number of years, then they are using those plans, but they're still required to sort of file the paperwork themselves, get reimbursed after they pay the assisted living facility or the nursing home. So I'm just wondering, like on a broad base view, are you seeing changes in long-term care coverage, and what do those changes look like? Are they still plans that pay generously, or are they all across the map?
As far as I know, I don't think they're as generous as they used to be. I think finding a plan is much harder, just because we're living longer and healthcare has skyrocketed. So I've never worked with a resident that's had long-term care insurance, but I'm sure it's more prevalent in other areas. But I can't really speak on that. If you did have more questions, you could call the Division of Health and Human Services, or I think there's someone up there that is an expert in long-term care insurance.
Yeah, just kind of another general comment or question. There's an old adage about basically being able to walk into a facility. If you can't walk in, you're not even considered. Is that a fact? Number one, i.e. assisted living type of facilities.
No. What do you mean by that? Like financially or?
No, not financially, physically.
Oh, no, I would say that's probably not true at this point.
And I think what he's talking about is the ones with the continuum of care from independent to skilled nursing. And we have been told that you cannot move into an independent living situation without the mental capacity and the physical capacity to truly be independent and care for yourself.
Right. I don't work in independent living facilities. I have no jurisdiction, so I'm not, I don't know. And we don't have any CCRCs or continuing care communities in our 7-county region. So unfortunately, I'm not that familiar with those, but as far as, assisted living, I see it across the spectrum as far as where people are in their health. There's some people that can drive their cars still, and some people that are bedbound. So it really just depends.
Kind of a follow-up. 6-7 years ago, time frame, I believe. Appalachian Health Systems sent out surveys to various residents, and maybe every resident, I don't know, asking about long-term care, interest in, et cetera, for this area, i.e. Foley Center and beyond the Foley Center, individual homes and or duplexes or whatever. And Liberty, I believe, is the company that was affiliating with Appalachian to pursue this. Do you have any update on that type of thing today?
I do not. I cannot speak on that. I know Liberty does own that building now, and don't think that the hospital has any part of that anymore.
I should just ask my wife.
He was at, yeah. I don't want to misspeak.
Can you be an honest? No.
He was asking about the Foley Center and who owns that. Blowing Rock. Yes.
There seems to be a trend, at least I think there is, about people being cared for in their homes more often. Do you notice any impact that has on nursing homes? Whatever that's called.
On the census.
Yeah.
So I guess since COVID, we have seen census numbers, with census just meaning the amount of people in the facility go down. So, I'm not sure if that's just people are, nervous about going into long-term care because we saw the impact that COVID had on nursing homes and assisted living residents, or if more families are kind of rallying together to see if they can care for someone in the home. I mean, we know that keeping someone in the home is much cheaper in the long run, than going into long-term care. So as putting money and services into home care is very important.
Stevie. It might be helpful to folks, so, I know you're aware that our the Harold Center. Our senior center can be very helpful. Particularly with the, if you're still at home, maybe getting not far away from going into the nursing home. Billy Joe up there, you know, is very good, Billy Joe Lister. And my wife and I went and sat down with her for a while, and it was very helpful. I know you got your plate full, because I've been with you for a while. But that might be helpful to know.
Yeah, so Mr. Hash was saying that your senior centers in your county, so the Lois Harrell Center here in Watauga. Or just look for your senior center in your county. I don't know if everyone here is from Watauga. But they're very helpful. They can offer in-home aid services, some transportation, congregate meals. They can help with taxes, they can help with Medicare counseling. So it's really a great resource and a great resource just to socialize with people. Yeah.
Groceries,
Yeah,
trying to make do without having to pay $9,000.
exactly. Yeah, I mean, everyone wants to stay in their home, and I don't know anyone that I've met that says, I really want to be here, but there's a time and a place, but like I said, if we can put more services and resources to keeping people in their homes, then the better we'll all be, but,
I understand that you are not an insurance expert,
not at all.
so I understand that boundary. Could you give me a rough idea of, for someone to go into a special care unit with dementia that has long-term care insurance? And they're being told they're not sick enough or ill enough to use it.
I really could.
Is there certain criteria to go into a special care dementia unit?
There is, I mean, I think it's just the diagnosis of dementia, and that's, I mean, as far as I know, that's the criteria, but as far as what your insurance wants to pay for, they can be as picky as they want and find reasons to not pay. I would say probably average around here, if you're paying out of pocket, probably around $5,000 to $6,000 a month for a special care unit, but assisted living can just really range. I mean, we have cinder block buildings, old cinder block buildings built in the 50s with no amenities to places that have their own chef and, they have happy hours, so they just range so much in their amenities and services.
Thank you. You mentioned video surveillance, that kind of intrigues me. Is this the norm now? Is this how we're overseeing communities and patients?
The question was about video surveillance. So video surveillance cannot be in resident care areas or resident rooms. That would just be in common areas like hallways, maybe outside the parking lot, things like that. And they still have to let you know if you're being recorded. In North Carolina, we don't have any laws. It's like nanny cam laws for nursing homes. So I get a lot of those questions. Can I put a camera in mom's room? And that's really a legal question. You have to think about if they have a roommate, that roommate's rights to privacy. It's pretty complicated, but as far as the facilities and cameras, it would just be in common areas.
I think one thing I would like to say is you just need to be persistent, because I've gone through some of all this stuff that you're talking about and not being directed to the right person in the beginning made a huge difference in what transpired. So I think you just have to really, and big thing is now is everybody saying, well, we don't have enough help, we don't have enough staff. And so you hear that all the time.
Right, but they keep admitting residents, so But it's a very confusing process and you're already stressed when you're thinking about having to go into long-term care. So, like I said, feel free to call me if you have questions about, what steps to take next, who should you talk to? A lot of times I think you just get referred off and then you get nowhere. So, it is confusing. Feel free to call me.
Is there a staff to patient ratio, mandatory ratio?
In nursing homes, there is not. The regulation says sufficient staff. So that can mean a lot of things. There is a ratio in assisted living. I don't know what that is off my head, but if you would like it, get it to you. But in nursing homes, we greatly need a staffing ratio. And so we've actually, there's a group called the Senior Tar Heel Legislators in North Carolina, and they push for that a lot, trying to get a staffing ratio in nursing homes, and other advocacy groups have also tried to push for that. It's been a challenge, but hopefully one day we'll get there. Any other questions? Concerns, thoughts? Thank you very much. Yep. Yes.
When you were talking about assisted living, you said $1,200 at one point. What is that?
So I don't know the exact amount. You'll have to call your Department of Social Services, but in order to qualify for special assistance, your total income has to be fairly low. It has to be in the $1,200 region to get the special assistance benefit
Per month.
per month. So that could be your disability or your social security.
So what does a typical assisted living home charge?
Like I said, it greatly ranges because some offer these really fancy services. I would say in our area, maybe $4,000 to $6,000 a month. And it might go up a little bit if you're in a special care unit, because you need additional services. I think if you looked in Charlotte, you could probably find some really expensive ones. But that's a huge issue in North Carolina that we haven't really dealt with as much in the mountains. It's been more in the Charlotte, the more metropolitan regions, but we're finding that people fall into this donut hole. They need assisted living, but they make too much for special assistance and they can't pay out of pocket. So, and they're not eligible to get nursing home care. So they fall into this weird place where, they need care, but they can't get it. And it's a huge issue, and it's becoming more prevalent. More assisted livings are not taking special assistance. They're only taking private pay. Now I've seen they have a contract where you have to pay private pay for 3 years before they'll consider you for special assistance. So it's getting tougher once you have a lot of assets.
I'm sorry, I didn't really. Has there ever been any talk here? I know in Asheville they have it, and I'm not sure that West Jefferson, but an adult daycare area. Because some of these people that, can't go into a facility if they have to pay for somebody in their home 24/7, it's very expensive too. But if there was an adult daycare, has there ever been any talk about something like that?
I think there's
occurring here?
in Watauga, or I think there's been talk. I know in some of the other counties, like Wilkes and Ash, have some adult daycares. There was one in Yancey County. It shut down. Do you know?
Ash generation.
Yeah, Generations Ash. It's greatly needed. Avery County had one, and I don't think they do at this time, but I think it would be a huge help for people that are caregivers. Get a break. Any other questions? All right, well, thank you so much. Like I said, I have cards up here, my phone number. If I forgot to say something, or if you have questions, call me anytime, email me. Happy to chat.
Yeah, thank you for coming. You'll have an assessment that was given to you when you came in. If you don't mind, either passing that to me, or there's a little basket on the door on the table when you go out. Our next, Mary Cheryl had talked about this before, April 14th. We have a flyer there for our next one, emergency room and hospital visits. And so we're gonna have groups coming up to the sim lab upstairs on the fourth floor or the fifth floor here. Third floor, excuse me, I'm getting my brain on myself, but yeah, so the third floor here has a sim lab, it's a nursing sim lab. And we're gonna take people through there and give you a little bit of an idea of what it might be like if you ever had to go into an emergency room situation. That's going to be one of the things that we do that day. So thank you. And on your assessment forms, we're beginning to plan for next season. We have our fall series coming up and we'd love to hear from you. What would you like us to project on? So there's a portion on that paper for you to write on to let us know. Thank you. Thank you. Thanks so much. Yeah. Yeah. Yeah.